Yeast vaginal infections are relatively common in women. Yeast is a common occurrence on the skin and the vagina. It's part of the flora that we're exposed to. What causes the yeast to overgrow and then irritate and infect the tissue is when it grows more rapidly. And this is common in states of high sugar. So for instance, women with diabetes are more predisposed to yeast infections. It's also more common in people that have their immune systems compromised by other diseases or infections such as HIV. And it's also more common in very high estrogen states, such as pregnancy, because estrogen helps to increase the thickness and the health of the vagina and the glycogen sugar stores in the vagina, which the yeast feed off of. In order to reduce the risk of yeast infections, we like to minimize the use of antibiotics, because when you're treated with an antibiotic to, say, treat an infection, it also seems to kill off some of the healthy bacteria in the vagina, like lactobacillus, and that allows the yeast to overgrow. So that's probably the most common causes of yeast infection. A woman's maybe treated for bronchitis or has an infection, is given an antibiotic, she gets over her infection, but then she gets a vaginal yeast infection. If a woman has recurrent yeast infections, she should be checked for diabetes, and I would recommend a 2-hour glucose tolerance test, even if the fasting blood sugar is normal, because 20% of people with diabetes have normal fasting blood sugars. And we also recommend an HIV test for recurrent yeast infections. The signs and symptoms of vaginal yeast infection can include an itchy, white, generally not malodorous discharge. It's a curd white discharge. In extreme cases, the genitalia can become red and swollen, and the woman can be very uncomfortable, primarily based on the itching. Now, certain strains of yeast, such as glabrata, can cause more of a burning symptom. But most yeast infections are caused by Candida albicans, and there are several treatments, both vaginal as well as oral, that can treat the yeast infection.